They say death starts in the legs. That sounds dark, I know. But medically, it is one of the most important warnings your body can give you, and most seniors miss it completely. Here is what is actually happening. As we age, the heart pumps a little less efficiently. The arteries narrow a little. The blood that used to reach every corner of the body now struggles to reach the furthest point from the heart. And the furthest point from your heart is your legs. The legs are not just where you walk. The legs are the early warning system. They are the first to lose power, the first to swell, the first to cramp, the first to refuse to do what they have always done. The moment you find it hard to get out of a kitchen chair without using your hands, your body is telling you that your foundation is failing. Not your muscles, not your knees, your foundation, the system that keeps you alive. Today, we are going to stop that process. I'm going to walk you through a 30-second test you can do right now, in the chair you are sitting in, that tells you exactly how strong your legs really are. The 6 foods that rebuild leg power and the circulation that supplies it. The 2 simple movements you can do while watching television that pump blood from your calves back up to your heart. And, most importantly, the 4 medical tests you need to ask for if the chair test is hard, because leg weakness is often a messenger for something deeper going on inside your organs. The medical test you need to ask for is an echocardiogram. This is a painless ultrasound of your heart that takes about 30 minutes. It shows your doctor exactly how well your heart is pumping. You should also ask for a BNP blood test, a simple blood draw that measures a hormone your heart releases when it is under strain. An elevated BNP is direct evidence of cardiac stress. Together, these 2 tests can detect early heart failure long before it becomes a crisis. Connection 2, the kidneys. Don't skip ahead. The 3rd section is the one nobody talks about. The connection between your legs and your kidneys, your liver, your heart. Most doctors will treat the leg weakness as a muscle problem. The doctors who know better know that the muscle is just where the symptom shows up. The cause is usually somewhere else entirely. Let me explain why this matters in a way most seniors have never heard. The medical community has a name for the gradual loss of muscle and strength that comes with aging. It is called sarcopenia. After the age of 40, the average adult loses about 3 to 8% of their muscle mass per decade. After 60, that rate accelerates. After 70, it can become catastrophic if you do nothing. But here is what almost no one tells you. Sarcopenia is not just about muscle. The same processes that cause your leg muscles to weaken also weaken the heart muscle. The same circulation that fails to reach your toes also fails to bring oxygen to your brain. The same protein deficiency that wastes your thigh also keeps your liver from producing the proteins that hold fluid in your blood vessels. The legs are connected to everything, and when the legs go, almost everything else is already in trouble. That is why we say death starts in the legs. Not because the legs cause death, because the legs are the first place death announces itself. They are the canary in the coal mine of your body. If you learn to read the signals, you have years of warning to do something about it. If you ignore the signals, you wake up one day in a hospital bed, and the doctors tell you it is too late. I do not want it to be too late for you. So let's start with the test. Section 1. The 30-second chair stand. This is a test physical therapists, geriatricians, and cardiologists use to assess functional strength in seniors. It takes 30 seconds. You can do it right now while you watch this video. You need a standard kitchen chair, one without wheels with a firm seat and a height where your feet can touch the floor flat. No armchair, no recliner, a regular dining chair. Here is how to do it. Sit in the chair with your back straight against the backrest. Cross your arms over your chest, with each hand on the opposite shoulder. This is critical. You are not allowed to use your hands for momentum or for pushing off. The arms stay crossed. Now when you are ready, set a timer for 30 seconds. Or watch the second hand on a clock. When you start, stand up fully, knees straight, fully upright, and then sit all the way back down. That is 1 repetition. As soon as your bottom touches the chair, you stand back up. Sit, stand, sit, stand. As many times as you can in 30 seconds. Count every full repetition. Standing all the way up, sitting all the way down. No half reps, no leaning forward to cheat. Smooth, controlled, full-range repetitions. Here are the numbers, and I want you to take these seriously. If you are between 60 and 64 years old, and you complete fewer than 14 repetitions, your functional strength is below average for your age. Between 65 and 69, the threshold drops to 12. Between 70 and 74, it drops to 11. Between 75 and 79, 10. Between 80 and 84, 9. 85 and older, 8. If you fall below the threshold for your age, your biological age is older than your chronological age. In some cases, decades older. Seniors who score below 10 on this test have significantly higher rates of falls, hospitalizations, and mortality within the next 5 years compared to seniors who score at or above the threshold for their age. But here is the most important number. If you cannot complete the test at all, if you cannot stand up from the chair without using your hands, even once, that is not a sign that you need to exercise more. That is a sign that you need a medical workup. We will get to that in a few minutes. Take the test, write down your number, do it again next week, and the week after. The number is the report card. The number tells you whether what you're about to do is working. I want to give you a quick story to put this in context. A man in his late 60s, active his whole life. He had stopped exercising in the last few years because of mild knee pain. He went to his annual physical, and the doctor told him everything looked fine. Blood work normal, heart rate normal. Blood pressure controlled. He was discharged with a pat on the back. 3 months later, he tried to get out of a low chair at his daughter's house and could not. He had to roll forward and use his hands. He laughed it off in the moment, but that night he sat at home and he tried the chair test for the first time. He could only do 6. He went back to his doctor and asked for the 4 tests we are about to discuss. He was diagnosed with early-stage heart failure that had been silently progressing for 2 years. His normal annual physical had missed it completely, because the test his doctor used did not measure what was actually changing inside him. The chair test caught what the standard physical missed. That story plays out in this country every single day. Seniors who feel fine, look fine, test fine on routine blood work, but who cannot get out of a chair without using your hands. The chair test is the test the medical system does not use often enough. You can use it on yourself in 30 seconds. Now let's talk about how to make that number go up. Section 2. The 6 foods that rebuild your legs. Your legs are a complex system. Muscle, bone, joints, nerves, circulation. To rebuild leg power, you cannot just eat protein. You have to feed every part of the system. Here are the 6 foods that do exactly that. And I'm going to tell you specifically what each one fixes and how to use it. Food number 1. Whey protein and eggs. This is the foundation. Sarcopenia, the muscle wasting we just talked about, is fundamentally a protein deficiency disease. Most seniors eat far too little protein, especially at breakfast. The body needs roughly 1 gram of protein per pound of body weight per day to maintain muscle mass after 60. The average senior eats about half that. Whey protein is the most efficient way to close that gap. It contains a high concentration of leucine, the specific amino acid that triggers muscle protein synthesis in the body. A scoop of whey protein in a morning smoothie is one of the simplest, cheapest interventions a senior can make for leg strength. Eggs deliver the same effect in whole food form. 2 to 3 eggs at breakfast, boiled, scrambled, in an omelette, provide a complete amino acid profile. The pattern that matters is the morning protein. Most seniors eat carbohydrates at breakfast. Toast, cereal, oatmeal, and save the protein for dinner. That is backwards. The morning is when your body is in the deepest state of muscle catabolism after overnight fasting. Front-loading protein at breakfast produces measurably better muscle retention than the same amount of protein eaten only at dinner. 25 to 30 grams of protein at breakfast, every day. That is the rule. A practical word for seniors who do not enjoy whey protein shakes. The taste is not for everyone. There are 2 workarounds. The first is collagen peptides, an unflavored protein powder that dissolves clear into hot coffee, tea, or oatmeal. You will not taste it, you will not see it, but the protein is there. The second is increasing whole food protein at breakfast. 3 eggs scrambled with a slice of cheese, a bowl of cottage cheese with berries, smoked salmon on whole grain toast, plain Greek yogurt with nuts. All of these deliver the 25-gram threshold without requiring a powder. Find the form that fits your morning routine. The principle is the morning protein. The form is whatever you will actually eat consistently. Beetroot does something almost no other food does. It is one of the highest natural sources of dietary nitrates, and your body converts those nitrates into nitric oxide. Nitric oxide is the molecule your blood vessels use to relax and widen. Wider blood vessels mean more blood reaches your legs. More blood reaching your legs means stronger contractions, faster recovery, less cramping, and warmer feet. This is not theoretical. Studies have shown that beetroot juice consumed before exercise meaningfully improves walking distance in people with peripheral artery disease. The same mechanism helps any senior who struggles with poor leg circulation. How to use it? A small glass of fresh beetroot juice 3 to 4 times per week, or a serving of cooked beets in a salad or as a side dish, or beetroot powder added to a smoothie. The cooking method does not matter much. Boiled, roasted, juiced, they all preserve the nitrates. A practical note. Beetroot will turn your urine and stool slightly red or pink for a day or two after you consume it. Do not panic. That is a harmless effect of the pigments and is no cause for alarm. Many seniors who do not know this go to the emergency room thinking they are bleeding internally. They are not. It is the beets. Salmon is the most concentrated common source of omega-3 fatty acids, specifically EPA and DHA. These two fats do something remarkable. They reduce the chronic inflammation that stiffens joints, especially the knees and hips. They also act as a kind of biological lubricant for the joint capsule itself. Most seniors complain about knee pain when they try to stand up from a chair. They blame age. They blame arthritis. Some of that knee pain is in fact mechanical wear. But a substantial portion of it is inflammation. And inflammation is responsive to omega-3 intake. 2 servings of fatty fish per week. Salmon, sardines, mackerel, herring, any of these work. Wild-caught is preferable to farmed when available, but farmed salmon is still a meaningful source. If you do not enjoy fish, a high-quality fish oil supplement at 1 to 2 grams of combined EPA and DHA per day provides similar benefit. Food number 4. Spinach and dark leafy greens. Spinach is one of the highest food sources of magnesium. Magnesium is the mineral that controls muscle relaxation. Without enough magnesium, your muscles cannot release after they contract. The result is cramping, twitching, restless legs at night, and that specific feeling of leg muscles that just will not let go. Magnesium also plays a role in nerve signal transmission. The signal from your brain telling your leg muscle to fire travels along nerves that depend on magnesium and other electrolytes. When magnesium is low, the signal becomes weaker, slower, less reliable. Your legs feel sluggish. You feel disconnected from them. A cup of cooked spinach has more magnesium than most people get in an entire day. Sautéed in olive oil with garlic, added to soups and stews, wilted into eggs, blended into a smoothie. Find the form you will actually eat. Eat it consistently. If your leg cramps wake you up at night, especially in the calves, you are almost certainly magnesium deficient. Magnesium glycinate or magnesium citrate supplements at 300 to 400 milligrams in the evening can resolve this within days. But the food is the better long-term solution. Food number 5. Greek yogurt and high-calcium foods. The hinges of your legs, your knees, your hips, your ankles, are bones held together by ligaments and powered by muscles. The bones themselves need calcium to remain strong, and seniors lose bone density at an accelerating rate after 70. A cup of plain Greek yogurt every day, mixed with berries, layered with oats and honey, eaten as a snack. The form does not matter, the consistency matters. If you are lactose intolerant or simply do not enjoy yogurt, fortified plant milks, sardines with bones, leafy greens and tofu provide alternatives. Calcium plus vitamin D plus weight-bearing activity is the formula for keeping bones strong. All 3 matter. Food number 6. Blueberries and other deeply colored berries. I know we have talked about berries before. There is a reason they keep showing up in these scripts. The compounds in blueberries, anthocyanins, flavonoids, ellagic acid, are some of the most powerful anti-inflammatory compounds available in the food world. For your legs, specifically, the relevant mechanism is reduction of systemic inflammation. Inflamed muscles feel heavy, weak, and slow to recover. Inflamed joints feel stiff and painful. Inflamed blood vessels are less efficient at delivering oxygen. Reducing chronic inflammation gives every other system in your legs a better environment to function in. Half a cup of mixed berries daily. Frozen is fine. Stack this on top of the breakfast protein, and you have built one of the most effective leg rebuilding morning rituals possible. Section 3. The lazy workout. You do not need a gym. You do not need equipment. You do not need to leave your house. You need 10 minutes a day and the willingness to do 2 simple movements consistently. Movement 1. The seated leg kick. Sit upright in any chair, feet flat on the floor. Now straighten your right leg fully out in front of you, parallel to the floor. Flex your toes back toward your face. This is critical. The toe flex activates the entire muscle chain from your foot up to your hip. Hold the leg there for 3 full seconds. Lower it slowly back to the floor. That is 1 repetition. Do 10 repetitions on the right, then 10 on the left. Then a second round of 10 on each side. 3 rounds total if you can manage it. This single exercise strengthens the quadriceps, the large muscles on the front of your thigh that are responsible for standing up out of a chair. You can do this while watching television. You can do this while talking on the phone. You can do this in any office chair, any kitchen chair, any waiting room chair. There is no excuse not to do it. Movement 2. The heel-toe rock. Stand behind a kitchen chair or counter. Place your hands lightly on the surface for balance, but not for support. The hands are there only to catch you if you wobble. Now slowly rise up onto your toes, hold for 2 seconds, then rock back onto your heels, lifting the front of your feet off the floor. Hold for 2 seconds, then back to your toes, then back to your heels. That is 1 cycle. Do 20 cycles, twice a day if you can. This movement does something the seated kick cannot. It activates the calf muscles, and the calf muscles are sometimes called the second heart. Every time you contract your calf, you squeeze blood from the lower leg back up toward the heart. Sedentary seniors who sit for hours without moving end up with blood pooling in the legs, swelling in the ankles, and a higher risk of dangerous clots. The heel-toe rock pumps that blood back where it belongs. 2 movements, 10 minutes, every day. That is the entire workout. If you can add a daily walk on top of that, even just 10 minutes around the block, you are doing more for your leg strength than 90% of seniors your age. A note on consistency over intensity. The biggest mistake seniors make with leg exercises is going too hard, getting sore, getting discouraged, and quitting. Do not do that. Start with 5 repetitions if 10 is too many. Start with 1 round if 3 is too many. The exercises only work if you do them every day for weeks and months. A small daily dose beats an intense weekly session every single time at our age. The body rebuilds in tiny increments, not in big leaps. Trust the process. Take the chair test once a week. Watch the number climb. That climb is the proof. Section 4. When the problem is deeper. The internal organ warning. Now I need to shift gears, because if you took the chair test and you could not complete it, or if you completed it and felt genuine pain, dizziness, breathlessness, or anything more than ordinary fatigue, then the problem may not be your muscles at all. Leg weakness, in seniors, is often a messenger for failing internal organs. The legs are the first place to show what is going wrong somewhere else. Let me walk you through the 4 most important connections. Connection 1. The heart. When the heart muscle weakens, even slightly, it cannot pump blood all the way down to your feet and back up against gravity to your chest. The fluid that should be circulating instead pools. Where? In the lowest place. Your ankles, your calves, your feet. The symptoms are specific. Swollen ankles by the end of the day. Cold feet that do not warm up easily. A feeling that your legs are heavy, like they are made of lead. Shortness of breath when you walk up a few stairs that you used to climb without thinking. The medical test you need to ask for is an echocardiogram. This is a painless ultrasound of your heart that takes about 30 minutes. It shows your doctor exactly how well your heart is pumping. You should also ask for a BNP blood test, a simple blood draw that measures a hormone your heart releases when it is under strain. An elevated BNP is direct evidence of cardiac stress. Together, these 2 tests can detect early heart failure long before it becomes a crisis. Connection 2. The kidneys. Your kidneys filter your blood 24 hours a day. When they work well, fluid and waste leave the body through your urine, and the system stays balanced. When they begin to fail, fluid accumulates and toxins build up. Where do they accumulate? In the lower extremities. your shins, your ankles, your calves. The hallmark sign of kidney-related leg swelling is what doctors call pitting edema. Press your finger firmly into your shin and hold it for 10 seconds. Now release. Look at the spot. If the indentation stays there, if you can see the dimple your finger left behind, that is pitting edema. That is fluid that has built up in the tissue because your kidneys are not clearing it efficiently. The medical tests you need to ask for are a GFR, the glomerular filtration rate, and serum creatinine. These are standard blood tests that tell your doctor exactly how well your kidneys are filtering. They cost almost nothing. Most insurance covers them. Most seniors have never asked for them specifically. Connection 3. The liver. Your liver produces a protein called albumin. Albumin is what holds fluid inside your blood vessels. When albumin levels drop, because the liver is not producing enough, fluid leaks out of the vessels into the surrounding tissue. The result is significant swelling in both legs, sometimes spreading up into the abdomen. The medical test you need is a liver function test, sometimes abbreviated as LFT. It checks for enzyme levels and protein production. If your albumin is low or your liver enzymes are elevated, the leg swelling has a hepatic source. Connection 4. The arteries. Sometimes the heart, kidneys, and liver are all working fine. The problem is the pipes that deliver blood to the legs themselves. This is called peripheral artery disease, PAD. The arteries in the legs become narrowed by plaque, and not enough blood reaches the muscles when you walk. The classic symptom is claudication, a sharp cramping pain in the calves that comes on after walking a certain distance and resolves when you sit down. Many seniors blame this on age, on arthritis, on being out of shape. It is none of those things. It is a circulation problem. The medical test is the ankle brachial index, the ABI. The doctor measures the blood pressure at your ankle and compares it to the blood pressure in your arm. The ratio tells them whether the circulation in your legs is normal or compromised. The test takes 10 minutes. It is non-invasive, and it can save your life, because untreated PAD is a strong predictor of heart attack and stroke. Section 5. What to ask for at your appointment. When you go to your doctor, do not just say, "My legs feel weak." That phrasing leads to a generic exam, a few stretches, maybe a referral to physical therapy. You need to walk in with specific requests. Ask for a comprehensive metabolic panel, the CMP. This single blood test covers kidney markers like creatinine and BUN, liver markers like ALT, AST, and albumin, and electrolytes like potassium and magnesium. Low electrolytes alone can cause dramatic muscle weakness, and they show up immediately on this panel. Ask for the BNP and the echocardiogram if you have any of the cardiac symptoms: swelling, breathlessness, cold feet. Ask for the GFR and creatinine if you have pitting edema. Ask for the LFT if the swelling is bilateral and severe, or if it has spread above your knees. Ask for the ABI if you experience cramping when you walk. 5 tests. Most of them will be ordered together. Most of them are covered by Medicare. Most of them produce results within a week, and together they tell you whether your leg weakness is a muscle problem, a circulation problem, or an organ problem. The treatment is completely different depending on the answer. Section 6. When to skip everything and go to the emergency room. There are 3 signs that mean the chair test, the foods, and the lazy workout are not your priority. Drop everything and go to the emergency department immediately. 1. Sudden swelling in only one leg. Both legs swelling slowly is usually heart, kidney, or liver. One leg swelling suddenly is often a deep vein thrombosis, a blood clot. A clot in the leg can break loose and travel to the lungs, where it becomes a pulmonary embolism. That can kill you within hours. Do not wait. Do not call your regular doctor. Go to the ER. 2. Shortness of breath alongside leg weakness. This combination, especially if it is new, especially if it came on over hours or days, can indicate acute heart failure or a pulmonary embolism. It is not something to manage at home. 3. Wounds on the feet that refuse to heal. A cut, a scrape, a blister that has not closed in 2 weeks is a sign of severely compromised circulation, often combined with diabetes or PAD. Untreated foot wounds in seniors are how amputations begin. Get them looked at immediately. These three signs are non-negotiable. Everything else in this video is preventive. These three are emergencies. The bigger picture. We say death starts in the legs because the legs are the first to show that something deeper is failing. The heart that is no longer pumping efficiently, the kidneys that are no longer filtering, the liver that is no longer producing the proteins that hold your fluids in place, the arteries that are no longer delivering blood to your muscles. If your lazy workout and your 6 foods improve your chair test number within a few weeks, congratulations, the problem was muscle, and you have caught it early. If they do not improve the number, or if the test is hard from the start, the problem is deeper, and the tests we just talked about are how you find out. Either way, you now know more about leg health than the average senior. More than the average physical therapist tells their patients. More than your doctor will explain to you in an 11-minute appointment. The legs are the foundation. Take care of the foundation, and the rest of the body has a chance. Ignore the foundation, and everything else eventually comes down. If this video helped you understand what is actually happening in your legs, do 2 things for me. First, share this with one senior in your life. A spouse, a sibling, a parent, a friend. The chair test alone could change someone's life this week. You may be the reason they catch a heart problem, a kidney problem, or simple sarcopenia early enough to do something about it. Second, subscribe to this channel, because next week, I am covering the morning routine that adds years to your life. It is shorter than you think. It is simpler than you think. And it builds directly on what we have talked about today. Before I let you go, let me give you the 1-minute version. Save this, send this, come back to it. The test. 30-second chair stand, arms crossed, no hands, count your reps. Below 10 is a warning. The 6 foods. Whey protein or eggs in the morning. Beetroot a few times a week. Salmon twice a week. Spinach for magnesium. Greek yogurt for calcium and protein. Blueberries for inflammation. The lazy workout. Seated leg kicks, 10 per side, 3 rounds. Heel-toe rocks, 20 cycles twice a day. The medical workup if the test is hard. Comprehensive metabolic panel. BNP and echocardiogram for the heart. GFR and creatinine for the kidneys. Liver function test for the liver. Ankle brachial index for the arteries. And the 3 emergencies. Sudden one-leg swelling. Shortness of breath with leg weakness. Wounds that will not heal. Take the chair test today. Write down your number. Then start the foods, start the movements, and watch the number climb. Take care of yourselves. Stand up, sit down, and I will see you next week.